Thank you for joining us for Open Line tonight. Having a good conversation about the status of our rural hospitals across Tennessee. As many as you know, they are closing at a very rapid pace. As you ladies were telling me, we're number one in the nation when it comes to these closures, which is pretty scary, especially if you are living in a rural area and needing that emergency health care. And it's a trickle-down effect. You get the ambulance to take you a farther distance away. The phone rings again at 911, and then that ambulance is gone. Yeah. They can't get to the next person.
So true.
So very true. So, by the way, the phone lines are open. 615-737-PLUS is the number to call if you would like to ask a question or chime in about how this has impacted your life. Want to introduce you to our guests one more time. We have Michele Johnson, the Executive Director of the Tennessee Justice Center, and Rebecca Jolley, the Executive Director of Rural Health Association. Thank you again for being with us. I did want to touch again on folks who do have insurance and they say, well, and I live in Nashville, you know, things are fine. I can just go right downtown. It may take me 30 or 45 minutes to get there, but I'm okay. But actually, we're still feeling the effects of all these closures and insurance going way up.
Yeah, I mean, we're bearing the cost. Experts say that we all pay about $1,000 per family tax per year because of this uncompensated care, because we're paying higher prices for things that we basically need because there's lots of care that is uncompensated. So. And the cost of healthcare just keeps growing. So it becomes, even privately insured people find it unaffordable and can find it financially devastating for their families. But I guess the other piece with privately insured folks is these hospitals are not just closing for the poor, they're closing for anyone who happens to have a parent have a heart attack on the way to vacation, or, you know, a teenager who is driving to see a friend. You know, these hospitals have been a vital part of our community in stabilizing, and they're really, you know, there's no system for catching those emergencies with 15 more hospitals closing on top of the ones that have already closed. It's really, it's a crisis.
And Rebecca, I know you wanted to point out the importance of telemedicine. First of all, tell us what that is and tell us how it's having an impact here.
So we have a profound footprint already established in telehealth, telemed, within all of our rural communities and even our urban communities. One of the things that I was very privileged last week to go out and get to see firsthand was a tele-ICU out in rural West Tennessee.
Okay, tell me how that works.
I got to see a 4-pound baby in a NICU that was delivered in one of our rural hospitals prematurely, of course, and he got to stay home.
Wow.
At his delivering hospital, because they had a tele-NICU relationship with a provider at a local urban hospital that had the specialty services that baby needed. And gosh, what a blessing to that baby's family. Could you imagine just having a little 4-pound baby that had to get shipped off miles away to another community, to another hospital outside of your immediate reach as a grandmother, a grandfather, aunts, uncles? I'm sure that just even mom and dad.
Right. Well, it can uproot an entire family. I do understand it because my family has been through it, and it requires that one of the caregivers often leave their job, perhaps leave their health care behind, just to take care. You know, because you have to. You have to do that.
You can't.
Yeah.
You can't just let it go. And so another thing that we also got to recognize last week firsthand, kids are going back to school. Along with that, trauma is going back to school with them. And our state is not insulated from the opioid crisis at all. And our kids are frontline survivors from that. And a lot of the times they are introduced into alternative care models.
Yes.
So they may have a traumatic experience at home, and the very next day they are responsible for reporting to school. And a lot of times nobody tells their school community what just happened the night before, the day before. One of the things that I'm very proud about our state is we recognize the importance of ACEs, adverse childhood events, and we also can extrapolate from that the cost of care to all of us as individuals that have ACEs. move forward into adulthood, and they carry that trauma with them. So we as a state have proactively intervened on behalf of children, and we have something that is called Handle with Care. And when that child goes to school the next day, they may not perform up to par, up to their norm.
Completely understandable. Yes.
Completely understandable. But we are able to advise their teachers, the administration, handle them with care.
Right.
And we're also able to introduce telemedicine into the schools and have them have an intervention with a professional in behavioral health that can talk to them in their time of need before it becomes emergent or before they carry that weight into adulthood.
Yes, because you said if addressing the situation and being proactive about it can help alleviate those costs going forward for years to come.
And just the trauma.
Let's get back to the phone lines. We have Joe joining us tonight. Hi, Joe. Thanks for being part of the show.
Hi, thanks for taking my call.
Sure.
There's a couple things that I just wanted to mention. I was born in Philadelphia, and I grew up in the suburbs of Philadelphia, and moving out into the rural areas outside of Philadelphia, you had to have money. You were wealthy. Unfortunately, in Tennessee, more people move out to the rural areas because they don't have the money.
Right.
It's cheaper to move out to these rural areas. Another thing is with the hospitals, how the state and federal government regulate prices on milk and eggs and bread and stuff like that. Couldn't they regulate what charges as far as the hospital, as far as what they can charge for certain medicines or for certain... And I'm not a big fan of big government, but I'm sure there's a way they can say, you know what, you don't have to charge $5 for an aspirin. I mean, they should be able to regulate these things just like they do milk. Milk is regulated. Every state in the country has regulated milk. So I'd like to hear your answers on that.
Okay, we're going to put you on hold, and we're going to take a quick break because I have to. When we come back, we will get to that. All right? Stay with us.